Hello, my name is Swathi Weaver, LPCS. Today I will be demonstrating Dr. William Glasser's reality therapy and to be specific, choice theory. Today we'll be demonstrating with Rachel, who is a 25-year-old single, never married, female identifying client who was referred for work stress. Rachel is a nurse and she has been out of nursing school for 2.5 years. This is not her first job since leaving nursing school. She lives alone, she works at a hospital, and she has a dog as one of her primary support systems. She just recently moved to the Austin area and she has been referred to us today again for work stress. Hi, Rachel. How are you doing today?
Good, how are you?
I'm doing well, thank you. Tell me what brings you into the office today.
I'm having a hard time at work. I feel like there's a lot of favoritism going on and I'm feeling overwhelmed and it's making me want to consider other jobs. Like, I don't know if I want to stay on this unit, but I've only been there for 6 months.
Yeah, so something's going on at work, and so even though you've only been there for a few months, you're wanting to quit or try to find some other solution.
Yeah.
Okay. Talk to me about some of the things that you're unhappy about.
So this is my first pediatric job and I really like that aspect of it, but I feel like on the floor I'm experiencing a lot of anxiety while I'm on the shift. And I feel like I'm also kind of being bombarded with a higher patient load than some of my other nurses who started at the same time as me. So we're all like equal in level of like seniority, I guess. So we should have roughly the same patient load, but I feel like I keep getting really difficult patients and they're getting patients that have strict ratios and are usually very easy to handle.
Oh, okay. So your unhappiness comes a lot from what your other coworkers are doing.
Yeah, because it's hard to like feel like things are being fair when you have 4 or 5 patients doing admissions, running around the unit, and then you see your coworker who started at the same time as you sitting in the back of the unit, literally watching Netflix like on their iPad, like at the nurse's station.
Yeah, that seems unfair.
Yeah.
Yeah. What have you done so far to help your situation?
I don't know what I can do for it because the assignments for the night shift are made during the day shift, like by the day shift charge nurse. There's really no reassigning of people once that's been established. The only thing that the night shift charge nurse does is like when we get new admissions, she can be like, okay, who's next in line to get one? And then they'll like measure out like, oh, who is the busiest patient, who doesn't. Yeah. But I feel like I'll literally come onto shift and I already have 3 people and I am at the top of the board, which means I'm like next in line to get an admission. And I just don't feel like it's fair.
Yeah.
When I see like so-and-so has strict ratio of 2 patients and those 2 patients, they're there for, while like there's a strict ratio for a reason, 95% of the time it's just that they want the kids to sleep at night, so really nothing happens.
Yeah. So I'm hearing that there's a lot of areas where you feel like you don't have a choice.
Yeah, like I don't want to be the nurse that complains and be like, oh, this is unfair, and like it, especially being on the newer end, I don't want it to make it seem like I'm not a team player. Yeah. And just complains about any assignment given to me, but it sucks when you're like working almost every single weekend, you're dealing with 3 patients from the get and then always getting admissions and like running around with like as if you're a chicken without a head.
Yeah. So a lot of people come to me when they feel stressed like this and they feel like they don't have a choice. And the great thing about the theory that we practice from, choice theory, is that we emphasize that you do have choice in some part of your life. So we have this thing called external control, where a lot of people live life thinking that everything in their life is controlled by them around the people around them, and that it's hard for that person to feel like they have a say in their life. So coming to me, you are already kind of curious about choice theory, so I want to talk about choices that you have that you could do to change what you're going through. So I heard you mention at the very beginning that you're maybe thinking of quitting.
Yeah, I mean,
So that's a choice that you have. Yeah, tell me about that.
I think it kind of, like a thought kind of planted in my head a little bit, because I had a really bad shift, like I was really anxious, I was, really stressed out about one particular patient. And it just made me want to be like, that's it, I quit. So I kind of was like searching for, that Google search you do, it's like pediatric jobs near me.
Yes.
And I was wondering, like, I don't know, like maybe this is a sign that I need to move to a different job. I don't know. Like I had a hard time figuring out whether or not it's like, is this the kind of stress that I will grow from, or is this the kind of stress that I'm like, I should see it as a red flag and go?
So what sort of jobs do you see yourself having if you choose to quit?
I've been curious about outpatient jobs. It's a much more stable lifestyle, and I'd be able to work during the daytime, which would be nice for my sleep schedule. And I think that would really, like, on the back end, help with the kind of stress I'm dealing with, because I have a hard time sleeping too, with back and forth night shift, daytime, night shift.
Yeah, that must be stressful.
Yeah, I think that's one thing so I guess one choice I have is switching a job to just any nursing job. And then the other thing I'm considering is just, do I want to keep working in a hospital, or do I want to look elsewhere?
Yeah, so you don't have to stay in a hospital is what I'm hearing you say.
Yeah.
What about at your current hospital? What choices could you change there to help make the environment better for you?
I guess I could have a conversation with a charge nurse during the night shift. I think if there's I've never been given an unsafe ratio or anything like that, like patients I'm not equipped to handle. So it's not like there's any legal issue with that. I guess it's just I'm scared to bring it up to the charge nurse in general. But it is a choice. I could tell her, hey, I'm not really comfortable taking on X type of patient, can you maybe switch me out for a different one if I'm feeling like this is too much for me to handle on a certain night. It's just frowned upon. Yeah.
And so let's say that you do choose to talk to that charge nurse and let them know that you would like an additional support, or you want a different patient load. And what if, have you done that before?
I'm too scared to.
Okay. What if they say no? What do you think you could choose to do then?
In that case, if I'm told no, I would, that at least that shift I have to work with what with who I got on my list. But I guess it is something I can escalate if I think it's too much. So if not the charge nurse, that's something I could bring up to the manager and have a conversation with her and say like, hey, I'm having an issue with the kind of assignments I'm being given, and I feel like I am not getting any experience in our monitoring unit at all. And I feel like I'm a little overwhelmed.
Yeah, so with the choice of bringing up to the charge nurse and they say no, you have further choices of, you could either just suck it up and continue to do your job in a safe manner, as you've mentioned, or if you still felt uncomfortable, then you choose to go higher and bring it up with somebody else, even higher than the charge nurse. So out of choosing to stay at work or choosing to find another job, which ones do you think would be good for you right now?
I think I still want to continue my job search because working during the daytime is still something I'm interested in. It's not a absolute hard no at my current role. It's again just frowned upon to like jump the line and request it, because there's kind of a long line of people on the night shift who want to move to day shift.
And you've
So,
only been there 6 months, so
right,
maybe
so
your
I'm
priority.
yeah, I'm lower on the totem pole there,
Yeah,
with asking. So that's one thing I could ask, like if I went directly to the manager, she would probably take pity on me and consider it, but I would definitely get some feedback on that from other nurses who I've skipped.
well, one of the things that we emphasize in choice theory and reality therapy too, is that we can't control what other people say or do. The only things that we control is what we do. So it sounds like you would like to move forward with the choice of choosing to stay at where you're at and try to make a change there with what you do.
Yeah.
Well, good luck, Rachel. Come back and see me next week. Let me know how that goes.
Okay.
And please know that you're welcome to call me or email me at any time if you need some more guidance or need some help.
Okay, sounds good.
Thanks for coming in today.
Thank you.
Hello, thank you for watching our brief demonstration on choice theory, Dr. Glasser's theory in his reality therapy. So as you saw in this video, choice theory emphasizes that, as you can guess, choice in an individual's life. So choice theory focuses on the present and the future of the clients. We do not ask questions about the past. We don't delve into childhood era. We don't focus on the past in choice theory. Dr. Glasser posits that it's not as important as the present. This is in direct opposition to the psychoanalysts of his times when reality therapy was created. There was an emphasis on memories and childhood upbringings at the time. Dr. Glasser did not believe that this was key or crucial to his sessions. He rather preferred to focus on the present and focus on the future of what's going on right now and what can happen in the future. So choice theory believes that choices that we make in our present day-to-day life is what matters. And as you saw in this video, I emphasized the word choice, choosing, all of those types of words, just to emphasize and re-emphasize to the client that the control is within herself and with the choices that she makes. So as she began to speak, she told me a little bit about what was going on in her life. I started with some reflections of how she's doing, a reflection of feeling, reflection of content. Then I asked her to talk more about her current role and what's going on. So a little bit of storytelling is okay at the beginning as they sort of catch the counselor up to what's going on with them. As you can notice, one of the first things that Rachel says is, I'm being bombarded. She uses those words. Dr. Glasser would say that this is an example of external control psychology, in which that Rachel believes that something is happening to her by somebody else. Whereas in choice theory, we flip the narrative and we try to emphasize choice of what maybe she is doing or what she can do to avoid feeling bombarded. So she's also saying things like, I'm getting really difficult patients. Again, saying things like what is happening to her. As you saw throughout the session today, that sort of changes and we get to talk more about future-oriented choices and what she can do to change what's happening to her. So that's the emphasis of choice theory, is to take what's happening to the client and kind of flip it around and make it about what the client can do in the future. When I say your happiness comes from what your unhappiness, comes from what your coworkers are doing, I'm trying to make her realize and make it clear that her feelings are related to what someone else is doing. So we try to move that narrative to connecting feelings to what the client is doing and seeing how those two are directly related. So I also asked questions like, what have you done to help your situation? Emphasizing that she does have choice and she does have control, and really brainstorming that this is something that can matter to you. This is something that you have control over, is that you can help your situation. So asking things like that in a solution-focused way can help with choice theory. So she talks about, it's interesting when I ask her, what have you done to help the situation? She again goes back to talking about what someone else does. She talks about the charge nurse and how the charge nurse assigns things for her and assigns the whole unit stuff. So again, having to redirect her and asking her what she's done to choose it. So she, voices some complaints about working every weekend and that they feel like they don't have a choice in working every weekend. So that's when Dr. Glasser would say, allow the client to say what they need to say, but then stop the complaints and bring choice theory to the forefront, educate on choice theory, which is what I did next. I told her about people that come to me, people that want to learn about choice theory, and they typically come when they are at their wits' end and they don't have a choice. So I introduced this just after she had told me a little bit about what other people have been doing to make her feel like she didn't have a choice. Because I did ask her, what have you done to help? And then she continued to tell me what other people have done. So then I brought that psychoeducation piece in. So we stopped her complaining, and then we went back to the original problem that she came in for. So allow the client to speak, allow the client to say what they need to say, but remember that the emphasis is going to be directly on going back to the issue they came in directly for, and emphasizing choice to change that issue. So then I asked questions about what would happen if you chose to quit. So using that word over and over again, really just instilling that things are a choice. So we explored, what would it be like if she chose to quit, switching a job or changing the setting is what she said. So deliberate phrasing to explore if she chose to leave her job. So helping her realize that she has a choice, whether it's to stay is the choice or to leave is the choice. And she explored a little bit about what it would be like to stay and leave. We talked about choosing to talk to the charge nurse. So as you can see, I will use that word choice again. And then I said, what would you choose to do if the charge nurse said no? So emphasizing the decision tree here of you decide to stay at your job, choose to speak to the charge nurse, and then what do you choose to do if the charge nurse doesn't say what you are wanting or doesn't acquiesce to what you want? Again, so if someone else says no, we still have a choice as clients to decide what to do at that point, is what we're trying to emphasize. So then I remind her again that she decides to either choose at work or choose to find another job. She's still saying that she's the one making the choices and giving her control back in her life, helping her realize that she really does have a choice. She doesn't have to stay in this job where she's miserable, having a heavy patient load. And even though she's only been there for 6 months, that she still does have other choices. So then Rachel says, I could ask someone. And she realizes that maybe she doesn't have to feel overwhelmed. She doesn't have to feel like she's being bombarded and that something is happening to her, and that she could step up and ask to change her situation. And this is where, once she's made this realization, I tell her, we don't control other people. We only control what we do. We've come to a good point at that point of the session of Rachel realizing what choices she has in order to rectify her situation and to help herself feel less stressed. At the very end, we summarize kind of what happened, and then we try to see our clients weekly in choice theory, and Dr. Glasser does emphasize being available for phone calls, emails, in between sessions if needed, if the client wants to update the counselor. And again, thank you for joining me today. That was choice theory in a nutshell. And I hope you learned something today. Thank you.